The equivalent of major plane crashes occurring every day. 270 people a day die in the United States from hospital-acquired infections.
What worries me about HAIs is that you just don't know where they're coming from.
Anybody who goes into a hospital room is potentially at risk.
Well, it's absolutely a global issue.
And it has evolved into a community health issue.
And I don't think there's a great deal of awareness around that.
A patient who's colonized with an organism or maybe have an active infection can quickly travel throughout the world, so I think we share really a global community now.
The overuse of antibiotics has resulted in what we call the superbugs.
Organisms, especially these resistant organisms, can survive such a long time.
No, there's no way we're keeping up with them.
Hand washing is probably the #1 thing that is the most important.
Hand hygiene is so important, but compliance is so low.
I think that the environment is significant.
I don't think it's necessarily that the disinfectants that are being used are the wrong disinfectants, it's just that they're not being applied systematically to every nook and cranny within the room.
What we need is new technologies that can help control the environment.
Because I believe you can stop transmission of infections with evidence-based practice.
Where we need to focus is on process and optimizing our processes.
I'm a director of infection prevention and control services.
I'm an infection preventionist.
I am a nurse in the operating room.
I'm a doctor and a bioengineer.
I'm a healthcare epidemiologist,
infectious disease physician
in Rochester.
I'm from New York.
I am from Canada.
Riyadh, Saudi Arabia.
I'm the infection coordinator in Guam.
I'm based in England.
We worry a lot about the lack of resources that we believe are really required to do a good job to battle these HAIs.
By eliminating hospital-acquired infections, you're going to actually save money.
Because you can't just think of the cost of prevention, but the cost if you don't prevent.
It's a problem with the solution, and we need to make progressive steps to move toward that solution.
Zero tolerance for infection is something that we should all aspire to.
It's really an investment that can't be seen on the bottom line. It can be seen in human lives.
There has to be a better way to fight this thing.
We have to do more.
We have to do more.
We have to do more.
It's everybody's business, whether they know it or not.
My goal, 0 HAIs.